Good morning, students. Today is the second lecture about blood transfusion. Blood transfusion is a very important topic because while you will be working in the wards, you will always have to transfuse blood to the sick patients, and you should be aware of the very important points. First is the preparation of patient. So first it is very important that the collection of blood is done properly, because as we know, blood can be transfused only if blood has been given by a donor. It is collected in the blood bank by the trained laboratory technicians, or sometimes in the blood donation camps also. There also, with all precautions, blood is collected by the trained staff. All articles which are to be used, they should be sterile. The donor labeling is very important. As soon as the blood has been withdrawn, the blood bag should immediately be labeled. Whose blood is this? What is the blood group? The date and time on which it has been donated. It should be immediately placed in the refrigerator. All the blood units which are there in the refrigerator, they should be inspected daily. Repeated freezing and thawing, it should be avoided. If it is done, it can hemolyze the RBCs in it, and it will become unfit for transfusion. Cross matching is very important before you give the blood. Then prevent air in the IV set, in the blood set. If it is there, it should be discarded. It should not let go into the body. It can cause air embolism. Vitals should be checked before blood transfusion, and during the transfusion also a vitals chart should be maintained, so that you can know any variation in the heart rate or temperature, etc., to detect an early transfusion reaction. Initially it is given very slowly, even 5 ml or 10 ml per minute, and if it is cold, when you bring it from the blood bank, then you can keep it for some time in the room temperature. Verify, because whenever the blood is issued, there is a verification slip on the blood bag that this blood of A with blood group, let us say B, has been cross matched for this patient X, and cross matching is okay. You must read the labels, because let us say the patient to whom you are giving blood, it should be meant for that patient only. Is it clear? So if the patient feels cold during the winter, you must have a blanket, and patient should be encouraged to use the bedpan before the start of blood transfusion. And now we come to the procedure. Explain to the patient and the relative that we are going to start the blood transfusion. It will take say half an hour or 45 minutes or so, and make the patient comfortable. If he has got any question, you should answer politely to the question, so that he is not panicky. Use an 18 gauge needle, because if you use a thin needle, they can do the fragmentation of the RBCs. Fix the catheter well, so that if patient moves the limb, it doesn't get dislodged. And observe the patient, because in the initial stages it is very important that the patient might get some reaction. Aftercare of the patient is that is also very important, and the cannula that you have, from which you have transfused the blood, you can start the NS from that very bottle if the further recommendation has been given by the doctor. But though the cannulas can be used, but the blood set has to be removed. You will need a new IV set for the fluids, but the cannula through which you have given the blood, that can be the same. So try to see that it doesn't get dislodged. If in a patient you have done the cut down section, in some patients the vein is not available and the patient is very serious, then in an emergency you have to do the cut down. If that has been done, then you have to do the bandage etc. on the cut down, and the stitches to be removed after 6-7 days. Now we come to the complication. First is the incompatibility. I tell you a real story. When I was SMO and there was a cesarean section going on in the operation theatre, and in between the cesarean section, half has been done, the child has been delivered, and as the gynecologist has ordered the blood was started, but after few minutes the patient started passing blood in the urine, and he was turning blue, patient, the mother, and the bleeding started erupting from the places where the operation was been done. वहाँ से ब्लीडिंग भी होने लग गई, पेशेंट को यूरिन में ब्लड आने लग गया, और पेशेंट थोड़ा थोड़ा ब्लू होने लग गया. सो एवरीबॉडी वाज पैनिकी कि ये क्या हो गया, एंड द पेशेंट वाज इमीडिएटली रेफर टू PGI चंडीगढ़, and later on it was found that the incompatible blood was given from the blood bank, and with that a hemolytic reaction occurred in the patient. What happens when the hemolytic reaction occurs? There occurs clumping of RBCs. These block the capillaries in the body, and with the clumping of RBCs, breakdown of RBCs, hemoglobin is released. It goes into the kidney tubules. So this all is a very serious reaction, and it is a question of life and death. So always make sure when you are starting the blood, whether it is the blood which is meant for this patient to which I am starting the blood. Sometimes pyrogenic reaction may occur. It may be due to bacterial contamination of the blood, or sometimes bacterial contamination of the equipment that you are using. What will happen? The patient will get fever, chills, and the skin will become warm and flushed. There may be third, allergic type of reaction. What will happen? These are due to the sensitivity of the substances present in the plasma. So some patients may get these type of allergic reaction. Some patients may get circulatory overload. Why this? Because if you give blood too fast, especially in a patient who has severe chronic anemia, then heart failure can occur. So this is also a very serious condition. So blood should be given very slowly as per the physician's instructions. Fifth is a transmission of infection. What type of HIV, syphilis, hepatitis B? These occur especially if the donor's blood has not been screened properly. So though blood is a life-saving drug, but these are the complications also which can take place with it. So if you want to ask, you can ask any question. Okay, thank you.